and have it available for reviewing later. It's going to be a ton of great information here, awesome information. I have my notebook here. If you're a note taker like me, get your notebook. I got a couple pens in case I run out of ink here along the way. Feel free to drop a line, say hello in the chat box there. We'd love to hear from you. And let me pull Kristen up here, and then she is going to introduce Dr. Sperling. I'm super pumped, super excited to have my friend, colleague, board certified periodontist here. You see, everybody is talking about the strength of the virus out there, and nobody is talking about the strength of the host. And this evening, we're going to expand our conversation we've been having in our office at Pure Chiropractic about the strength of the host and what we can be doing today proactively to strengthen our body, strengthen our health, to keep us going strong out there these days. Now more than ever, it is more important to be not only focusing on our health, but taking the right action steps towards our health. And I'm super pumped and excited to hear what Dr. Sperling is going to share with us here. So let me just bring her over, make host, okay. Kristen should be jumping on here in just a moment. Welcome, Kristen.
Hi there. How are you? Thank you for having us.
Oh, thank you so much for being here this evening. I know the people keep jumping on. The attendees are coming up. Obviously, this is a hot topic. People are super excited to learn some great information from Dr. Sperling.
Awesome. Great. Well, thank you so much. We appreciate the opportunity to be here. My name is Kristen Lewis. I work for Dr. Sperling. I am her marketing manager and her event planner. And I'm just going to give you a 5-minute briefing on who Dr. Sperling is and a little bit about our practice. So Dr. Sperling, in addition to being a friend and a patient of Dr. Brandon, she is a periodontist here in Vienna, and she's very successful and very busy. So I'm going to start off and share my presentation with you. Oops. There we go. That's the first part. Let's see. Okay. So I can, there was a, oh, hold on a second. All right, it's not letting me, there we go. Okay. So Dr. Sperling, she is a periodontist here in Vienna, and she started off her career in, well, she started off her education. She's from Israel, and she started off there, got her undergraduate and her master's degree there in her dentistry work. And then she came to NYU here in the States, where she specialized in periodontics. And she's a board certified periodontist. She's also a dental implant surgeon. So that means that she specializes in the treatment of gum disease, and she's placing dental implants, and she does a whole lot of other procedures that go along with that. Things like sinus lifts and bone grafts and lengthening of the crown and things like that. So she spends a lot of time with her patients, and she makes sure that everybody understands what she's seeing and then how she can help them. And so Dr. Sperling, like I said, her office is in Vienna. She is located across the street from Dunkin' Donuts, and she's got a great staff here. And she has 5 people in addition to me and her that work here. They are friendly, they are caring, they are competent folks, and they're great to work with. And we have a newly renovated office here, so we have a little bit more space than we used to, and it's a good time over here. So the other thing about Dr. Sperling that I think is important to know is that she's a leader in education. She's the host and a founder of a seminar series, and we hold about 4 to 6 presentations a year, and we invite dentists and specialists in the dental industry to come and listen to seminars. Sometimes Dr. Sperling's the speaker. Other times we invite speakers to come in depending on the topic. And it's a great learning experience for everybody. And she also hosts 2 smaller study club type things. One is for hygienists and the other is for, again, dentists and specialists. And, you know, they go over cases and they share, they collaborate, and it's a great learning environment there too. Additionally, she does things like this seminar where she talks about how it's really important to keep your mouth healthy because it does so much impact the rest of your body. So in addition to all of those things, Dr. Sperling's a mom of 3 beautiful girls, and so she's a busy lady. So real quick, I wanted to talk to you about our Facebook page. We are at Dr. Sperling. You can see the name there. You can search for it in the search bar. But our Facebook community is great. You know, we have information about what's going on in our office, some of the events that we have going on. Dr. Sperling often comes across articles and things that are of interest and that she feels are important for her patients and her folks to know. And so she'll post those types of things up there. We have information about how, you know, we're keeping our office safe and clean during this COVID pandemic. So there are a lot of things that you can find on our Facebook page, and we encourage you to go and invite you to go like us and follow us and join us. So the very last thing I wanted to talk about was tonight. We're having this seminar. There's a lot of you guys out there, and we're going to do a raffle. And this is a health basket that we created. There's some things to keep your mouth healthy. There's some things to keep your hands clean. There's some things to, you know, just be, you know, be healthy in these scary times. So what we want to do is we want to ask all of you to go to our Facebook page. And if you need to search for it, again, it's at Dr. Sperling. And follow our page and then scroll down and find the post that is for this seminar. And you'll recognize it because it's the person sticking their tongue out with the germs all over it. And find that post, and at the bottom of that post, you'll see the comment button. And if you just comment, please give us some feedback. Let us know what you think of the seminar. And you know, we'll leave it open for a couple days and let folks comment, and then we'll turn it off probably at the end of this week, and we'll have a winner, and we'll let you know probably by Facebook. And so we hope you guys all enjoy the presentation tonight. Dr. Sperling's going to step in here in just a second, and I'll see you hopefully in our office sometime. Thanks a lot for joining us.
Hi everybody. Thank you. Can you put the camera on me so it doesn't? It's on. So now they see the screen. One moment.
They see you.
Dr. Brandon, can you see my face, or do you see the screen? What do you see right now?
I see both. I see. Hello, Dr. Sperling. Welcome. Glad to have you here. We're all pumped and excited. I can see your screen, and I can see your camera here. So
you see the camera, the screen, and do you see the presentation going on right now?
Yeah, I
awesome.
see it. Yep, the oral health is health slide.
Wonderful. So we're big enough here. Great. So thank you everybody for joining. It's a little bit weird for us because I'm honestly telling you, we do a lot of seminars. I lecture quite often. I'm very comfortable with lecturing, but doing it through Zoom is a little bit different. I don't see the audience, so I just pretend that you're there. But I'm hoping that everybody can watch us. And we would like, I'll tell you how the plan today is definitely I'll do most of the talking. You guys right now are on mute. So I'm sure that I know a lot of you guys. And if you want to say something, it's going to be a little bit difficult. But we do have an area here that you can actually you can put some notes. The plan is to give out the presentation. It's going to probably take about maybe an hour, more or less. And then we would like to hear from you. We're going to do a session of Q&A. Part of the audience here, I have a couple of my good friends, general dentists here. And I have to say that we're all patients. I'm a patient too. I'm a dental patient too. I'm a patient of Dr. Brandon, actually. But we know how dental, and that's the topic of this presentation today, how everything dental is not only dental, how everything dental is actually body. So that's a huge connection. We see it every day. It's not only me as a periodontist that sees it in my office, it's all the dental community. So I'm actually, yes, I'm one person, I'm a periodontist, but I really have to tell you that I'm representing everybody here in the dental community, oral surgeons, general dentists, endodontists, which are root canal specialists, and so forth. And so it is insane. And every day there's just more research, more articles that are coming to tell us how much evidence there is between our mouth and our body and the effect of the whole situation on our health. So that's what I'm going to talk about today. Hopefully we'll have enough time. Hopefully you're not going to fall asleep, but if you do, feel free because I cannot see you. But that's the topic today, and I'm hoping that we're going to get some of your attention, and we'll help you to prevent some crises here. My fellows dentists hopefully can join me with the Q&A. So let's go ahead and start. Okay, so this is our mouth. So I'm gonna just talk to you again a little bit about anatomy, but this is what we see. When a patient comes to my office, sits on the chair, this is actually what I'm looking at. So you're seeing that our mouth is a very complex organ. So it's composed of many organs here, starting with the lips and the gums and the teeth. And then in the mouth itself, of course, we have the tongue, and you can see I'm going to use my cursor here, but the floor of the mouth, and it's all muscles that work together in an amazing way. So we're looking at muscles here. We're looking at, there are a lot of glands, salivary glands all over our mouth. The mouth is just really an opening. It's an opening to the outside world. And we have a lot of receptors in our mouth that are tasting, and it is quite amazing. And what else do we have in our mouth? And I cannot hear you saying, but I'm sure that you know, we have a lot of germs in our mouth. So germs are not necessarily bad. Germs are actually good. We need to have this symbiotic relationship between the germs and our mouth. So moving on, again, and this is just a dissection. This is from my old anatomy book. So you can see a great picture here that represent the mouth and not only the mouth itself, but also how the mouth is relating to our face and our body. So you can see that inside the mouth, again, the mouth is so complex. We have teeth. We have the first thing that happens is when the food comes into our mouth, it reaches the tongue. The tongue is one of the biggest muscles, actually the strongest muscles, not the biggest, but the strongest muscles in our body. And it has to be this way because it really helps with mastication, with us being able to chew the food and eat. And then inside the mouth, you can see that we have the teeth. The teeth are there to help us grind our food. And what are those? The two interesting organs here, or three actually, that looks like clouds, those are salivary glands. So you see how saliva is so important here because it really does a lot. We have a big gland here on the side. It's called parotid gland. And this gland, it opens inside our mouth. It helps us to secrete saliva. So that's the main one. But we do have some other ones. One is under the tongue. So you see those small, tiny openings here under the tongue where saliva secretes here. We have another one, which is under the lower jaw. And again, the saliva is it's needed. Why do we need saliva? And usually when I'm lecturing, I can hear some people saying, I need it for this. I cannot hear you, but I'll tell you. So saliva is there to help us moisture our food. Without saliva, think about people that have radiation like cancer, oral cancer. When they have radiation to their face, actually what's going to be destroyed first are the salivary glands, and those people are very miserable. Why? Because we need saliva to wash off the food. Saliva has a lot of enzymes. The enzymes are needed. Those enzymes are helping us out to already process and starting digest the carbs that we eat, especially the food that has a lot of sugar. those big sugar molecules are already cut down by enzymes in the saliva, and that helps our sugar, when it enters our body, get digested easily. The saliva also has a lot of enzymes that are important to kill some of the germs, again, cut off some of the lipids and things like that in our foods. And the fact that saliva moistures our food makes it easy for swallowing. We need saliva because we use our mouth for talking. So we need that. Without saliva, we would not be able to talk. We would have ulcers all over our mouth. So saliva, what is it made of? Mainly water, some salts. The salts in the saliva are helping our teeth. Some of them, they have fluoride. The fluoride is there to make our teeth stronger. So this system is a very sophisticated system. It works together. Interesting thing here in the picture too, you see all the, by the way, the green area here, the green line that you see here, this is the pipe that carries the saliva from the gland to our mouth. So you can see a couple of pipes here. Sometimes people have diseases, right? When there is too many, they don't drink enough, or they produce stones that can block this pipe. And again, saliva can be secreted, but it's not entering enough our mouth. So that's going to be a different issue. The lines that you see here, they look like almost small veins. Those are small nerves. Why do we need those nerves? So you see, interesting enough, those nerves are coming out. They're coming out. Actually, we have a lot of nerves mainly coming from the brain. There's a lot of nerves here going out to different muscles. Also in our mouth, they go in. Those nerves are responsible to give the energy to those muscles in order for the muscles to help us to contract and relax when we do our chewing, when we smile. You see all of those areas here, all those areas that are more like all those lines, all those pink lines here, they represent muscles. So again, this is a very sophisticated machine, because it's not only that food gets into our mouth. Remember, we have the brain tells us, hey, food is coming. Saliva is already being secreted for when we just think about food. Even before food comes, saliva is secreted because the body prepares the mouth to get some saliva. So then the food can be already started to get digested. Starting again in the mouth, it starts breaking up. And then our nerves, our brain tells our nerves, hey, you have to work. The nerves, they innervate our muscles. The muscles then can contract, and they start closing on the lips and the muscles. So, and then the teeth are coming into action. So then the food is being chewed, and it then becomes a very, very smooth piece. And then the muscles of the tongue and everything here, the food again later on will go down to the stomach, where it will keep on going, keep on digesting, and so forth. So again, it's a very complex mechanism. So what happens if something with this mechanism breaks? You know, that's what we're going to discuss about today. So I'm not here to tell you, because there are really tons of diseases that are related to everything here in our body, on our face and everything. So it's a very complex system, and it needs to work together. I'm here to tell you that, hey, teeth are definitely part of this. They're part of the mouth. They're part of this complex situation here, but they're also related to our body. We talked about the oral cavity. Just to summarize it, everything that we have in our mouth, we sense, we analyze what foods we have. The mechanical processing of the food is using the teeth, the tongue, and the palate, the roof of the mouth, the surfaces. We have lubrication, and this is done by secretions, mucus, and then saliva. The digestion is being done by starting with some enzymes that are in the saliva. And then let's talk about teeth. If you have questions, again, I do encourage you to write it down. There is a spot there when you can actually write down some questions, and I'll be more than happy to hear about them later. But let's dig in. let's talk about our teeth. So again, this is the time of my presentation where I ask people, who knows how many teeth we have in our mouth? Kristen, you're going to be my audience. How many teeth do we have in our mouth?
Well, I only have 24.
Kristen has 24, but normally with all of our teeth, we should have 32. So we have 16 teeth on the top, 16 on the bottom, and that includes the wisdom teeth. So the wisdom teeth are usually maybe not as functional as they could be, but let's look at teeth in general. So this is a molar tooth, and if I'm looking at a tooth, it has a crown, it has a neck, and it has a root. So if I do a cross section of this tooth and I'm looking at it, you can see that the crown is actually made, it's me. The crown is made of, the outer surface of the crown is called enamel. And this is a very, very strong surface, and it's actually stronger than any other organ that we have in our body, stronger than bones. Why? Because we need teeth. The fact that it's so strong helps us to chew our food. And without the teeth breaking, it helps us to keep our teeth for hopefully 120 years. So that's the white area that you see here, and it's made of calcium and phosphate and fluoride and a lot of other organic and inorganic material. Underneath the white, if I go deeper, you see that there is an area which is called dentin. So the dentin is actually a more it's not as strong as the enamel. It's a little bit more soft, but it's protective. And what the dentin has, it's connecting between the enamel to the inside of the tooth. That is called pulp. But the dentin is very important because it has some blood vessels, and it has some nerves, and it has a lot of good stuff. The dentin, again, as I mentioned, is more, it's not as thick, and it's more soft. And as we get older, because we talk and we eat and we chew and we function, what happens to the enamel is that it becomes thinner and thinner and thinner, and then the dentin is actually showing more. So people that are, as we age, as we get more mature, our teeth they wear out, the enamel becomes thinner, and then the dentin is showing more. So you can see the teeth of older people are more yellow. So it's not only because you drink more coffee as adults and you eat pasta and things like that, things that can actually stain, but also because it's a fact the enamel wears off, and then the dentin that is more yellow reflects from underneath. So that's why teeth of kids are more white, because their enamel, it's just a little bit different, but they're more white than adults. This is the fact. Underneath the dentin, we have the pulp, and that pulp is important. Why is it important? Because that's where all the nerves and all the blood vessels and everything that we need to keep the tooth alive, that's where everything is. So that's the pulp. So if somebody, by the way, have cavity, the germs that we have in our mouth, we have different germs in our mouth. The germs, the germs that are causing cavity, that are different than the germs that I'm going to talk about today, but those germs usually start penetrating from the outside the enamel. They start from here or from here, but they go from the enamel going down to the dentin, and when they get to the dentin, that's when you start feeling pain, and that's what will drive you to run to your dentist. Why? Because that pain can cause issues, and I promise you that when the cavity is deep enough, then you will start feeling pain, because we're getting close to the pulp. If the decay is too deep because you decided not to go to the dentist for some reason, or you couldn't because you were under quarantine because of COVID and who knows what, then sometimes what happens, the decay can get down deep to the pulp, and then the only solution to save a tooth like that may be doing a root canal. When a root canal is done, the pulp is actually they remove the pulp, and then they put, the good dentist would put a filling inside the tooth, and to protect the tooth against further cavity, further decay. So that's all nice and good, but let's focus more. I'm just zooming out for a second. Let's not look at the tooth. Let's zoom out and let's look at at what's holding the tooth, because this is me, this is my specialty. I'm a periodontist, and this is what I'm focused on. So when you see a general dentist, usually they would look at the tooth, they would search for cavities, they do crowns and fillings. My job, and I always compare my job to a contractor of a house. So the dentist would usually, if you have a problem here, they would deal with the problem of the house itself. I'm, as a periodontist, would deal with the foundation of the house, something that people usually do not see, that's not on the surface. So if we look again, let's look again at the foundation of the house. And you can actually see it's nicely demonstrated here in the picture. And I actually highlighted it here just so we can focus our attention to it. So you can see that the tooth is held in our mouth by a foundation here. The foundation is called periodontium, and it's actually composed by those 4 components here that I marked with blue. So the first ingredient here, those are the gums. The gums, that's what we see. The gums are soft tissue, and that soft tissue could be thick or thin, but that soft tissue is going all around our teeth. So where the gum ends here, the gum will end here, and that will actually be the separation between the crown and the root, right? The gums I'm talking about the normal situation where you don't have recessions. The gums are ending they will separate between the crown and the root of the tooth. The root, you don't see it because it's under the gums. So the gums are the first thing that will help us to hold the teeth in place. Underneath the gums, actually, when the gums are superficial, that's what you see. But you can see with my arrow here that the gums on the top, as we go down underneath, you see that all that pink area, which is nice and thick here, becomes more thin. And that line, and I'm just look at what I'm doing here. I'm going by that line that goes all around the tooth. That line represents a ligament. A ligament is something that connects. So that ligament, the name of that ligament is here. It's called PDL, periodontal ligament. And this ligament is actually, it's like a ligament, like ligament, like what, Kristen? Like
a cord.
Like a cord, like a ligament, like something that would connect. So if you're looking at that connection here, what does it connect exactly? It connects between the tooth and then to the bone. So that ligament connects between our tooth or our cement. Cement is another layer that goes outside of the tooth. Cementum, cement. So it really it holds the tooth in place. It connects between the tooth and the surrounding bone. That's the ligament, the PDL. I'm moving on. So again, this is a summary of what I just discussed. The periodontium is composed by gums, or how we as dentists, we call the gums gingiva. That's just a Latin name. But the gingiva are the gums. The periodontal ligament is the tiny, tiny, small, thin and nice and beautiful ligament that goes all around the teeth. That band that holds everything. The cementum is the layer that you see here. It's actually in white. It's another layer that goes all around the tooth. And then the bone itself. So that's what's holding the tooth in place. I'm going to be focusing today around all that area here because it has a huge influence on that's what's actually, this is the connection here. Let's understand why. So I'm going back again to the periodontal ligament, the PDL, the band. It looks so innocent, but that PDL, I'll tell you, and that's why I love perio so much, because it really has a lot to do with not only the teeth, but it has a lot to do with biology. And I'll tell you that, back in the day when I was in Israel, and after I did my dental, I was a dentist, a general dentist. I worked as a general dentist for 3 years. And then I decided, you know what, I really want to learn more. I want to do more. And then I went back to the university and I did a master's. and degree. And what I specialized was actually researching cells here inside the PDL. And those cells are, the PDL has a huge importance. So what does it do really? Why do we need it? So the first role of that PDL, and that's what we talked about, it has a supportive function. Why? Because it really holds, it's a band. It holds, it attaches the tooth to the surrounding bone. So without the PDL, if that PDL will get damaged, what's going to start happening to our teeth? They're not going to have attachment to our bone. What's going to happen? You may lose a tooth because that PDL, if that PDL gets damaged, the tooth cannot stay in our bone and it will fall off. Okay, so remember that. We're going to go back again to it later. The number 2 role of that PDL, it has a remodeling function. What do I mean by that? The PDL being so tiny and small, it has a lot of cells in it. A lot of those cells are very important. Why? Because those are undifferentiated cells. Those are cells that are staying there for a very long time. But if needed, if there is an injury, if you by chance, you floss, or let's say you ate popcorn and that kernel went into your gums, how many times did it happen? I know that it happens to all of us. So if you ate a popcorn and it got stuck in between the gums and the teeth, and then you feel that, oh, I hurt my gums, it's painful. The gums got damaged. You have now a wound in your gums. Cells from the PDL will start differentiating into gums cells. Remember, the gums are here. You look at the gum cells, the PDL cells, they have a lot of good cells there that can help correct that gum injury. So that's another reason why the PDL is so important. But it's not only the gums. The PDL can actually give us good sources of cells to the surrounding bone, to the surrounding cementum, and then cells that will build up the PDL itself if the PDL will get damaged. So it's extremely important. Another important role if that PDL is that it's rich with nerves, the ending of the nerves. Why is it important for us? Why? If you, okay, I ate a salad and I had, in my salad, I asked for a Greek salad, and that Greek salad, it has some olives in it. And I took a nice, but I was so hungry that I ate a big bite. And unfortunately, the person who made the salad for me left the pit inside. They didn't take the pit of the olive. And by accident, I hit my tooth. What do I feel when it happens? Instinct, yeah, and I'll tell you that it happens very, very fast because it's almost the connection between our mouth and our brain sometimes can be instant. And it happens because of the PDL. So if you eat something and that something was something hard, you ate something and it caught you by surprise, and it was hard, what do you feel immediately? You will feel the pain. If you eat something that is very cold and you get a brain freeze, but you also can get toothache because of that reason, because all those nerve endings that are inside that PDL. So that is very important for us. It's more of an evolution reason of why we have that, because it's a mechanism to protect our body. If you eat something that can damage your body, your brain needs to know. So immediately the brain, what happens, you eat something, that something was too hot, too cold, too sharp. The brain will send immediate messages to our mouth to open as a surprise and take the food is going to come out of our mouth. So that's more of an evolutional thing. So that's why we have pain and pressure receptors, nerve endings in that PDL. What else do we have in the PDL? We have a lot of blood vessels. Why do we need blood vessels? The blood has a lot of oxygen in it. It has a lot of nutrients, a lot of very important food particles inside. We need that to maintain the vitality because, again, we're all made of cells. We need that blood supply to those cells for them to survive. So again, without the PDL, or if we have damage to the PDL, that's gonna be, it will have a big effect on us. Today, again, and this was just, I know that I keep on talking and it's a lot, but the whole point of me building up is because of this. And that's what I'm going to talk to you about. So what I want to demonstrate to you is what I'm as a periodontist looking at. And this is a very important picture. If you look at this picture, it will show you two sides. One side of the picture is a tooth that is healthy, or actually periodontium that is healthy. And the other side is periodontium, which has a disease. So if you look at the picture here, you can see that the healthy side has a tooth that is again connected to our gums, has a very nice PDL, and the bone, this is a cross section again of the bone, all the yellow is the bone. You see that the bone here is healthy, it's dense, and everything looks nicely intact. When we have a disease, a gum disease, a periodontal disease, a disease that affects our periodontium, everything around, periodontium is a Latin word that represents everything around the tooth, periodontium, around the tooth. So that disease will affect the gums. It will cause a separation here, and that separation would lead to inflamed, diseased gums. The bone will get lowered, and then a pocket will form. That pocket is a space between the gums and the teeth, and then everything, you see how the PDL is destroyed here. So eventually down the road, when people have periodontal disease, the tooth, it's not that the teeth are being affected, it's actually the surrounding of the teeth. It's the foundation. Periodontal disease, let's talk about that. What is a periodontal disease? Periodontal disease is an infectious disease. It's an infection. It's usually a chronic infection. That periodontal disease, in order for this disease to happen, we need two things to happen here. We need certain bacteria, germs, that most of us, by the way, have in our mouth. And I'll tell you that most of us, if not all of us, carry those germs in our mouth. Germs, we have it on, it's part of our flora, part of our body. I don't know if you knew, but in our mouth, we have about 700 different species, different types of germs. Some of those germs are great, and some of them are not. And we have a status quo of germs in our mouth. In order to have a periodontal disease, certain germs need to affect our mouth, but they may be there, but what else needs to be happening here? So again, as I said, periodontal disease, it's not only germs, because I may have the same type of germs that Joe has, but Joe is a host and he may be more susceptible to have a disease. So why is that? It could be that Joe's immune system is not as strong as my immune system. Maybe something about his antibodies or his immune system, it doesn't work. So when Joe is exposed to the bad germs and his immune system is not good enough, then things start to break. And as I showed you, that's the periodontal disease. He is more prone to have the disease. And we'll talk about it more today. If you look at this scheme, you can actually see what's happening here. So I'm going back again to this. It's again, remember what I said, periodontal disease, it's an infectious disease. It's an inflammatory disease, all of that. What does it mean? It means that inflammation, infection, they act together. So what really happens here is that germs that we have, it's called biofilm. The germs in our mouth, it's called biofilm. Biofilm is just germs that are staying in our mouth and they sit on our teeth. So if you know one thing or two things about boats, you know that boats, on the bottom of any boat that is in the ocean, there is a biofilm. Also on boats, there are certain type of germs, algae, things like that. They stay under the boat. Same here. So biofilm is just a layer of germs that are living together. They create colonies. In any case, the biofilm, it's here. And then when our mouth is exposed to germs, because we have 700 species of germs in our mouth, the germs in our mouth, they start to, they stick on the gums and on the teeth, and that's how they enter our mouth. And then they cause when they're here, and if you guys are not doing a good enough job removing them by brushing or flossing, those germs will start penetrating the gums. So you can see the gums here that are red because those gums are inflamed. And then a disease starts. And the disease, the germs are going to not stop where the gums are. Sometimes they do stop. And that is a disease, an initial disease. It's called gingivitis. But if you continue not to do a good job with brushing and flossing, and again, if your immune system is compromised for different reasons, maybe you're stressed out, maybe your diet is not great, maybe your genes are not the best ones, maybe you're a little bit compromised on your immune system because you're suffering from other diseases like diabetes or heart disease or who knows what, those germs will find a way and they will start entering deeper and deeper and deeper, and then they will create an inflammation. So you can actually see that the germs are there. They are opportunistic. They're waiting for their opportunity to invade. What are they waiting for? They're waiting for the right host, the right person. You can see here what it says here, susceptible host. The susceptible host are people that they're immunocompromised, people that have systemic diseases like high blood pressure, like diabetes, like cardiovascular diseases, like lung diseases, people that are obese, if you're not, your weight is not correct. If you're a smoker, are you stressed out? Are you aging? Do you have other germs in your mouth? So all those germs that are pathogenic, that are bad germs, they will start acting up. They will break down the good relation. They will cause some other good germs. The good germs, as I said, we have good germs and bad germs. The good germs are going to be lowered in numbers. The bad germs are going to start increasing in size. And I'll tell you that once the bad germs find a way to go down under the gums, it's an excellent niche for them. Why? Because under the gums, this is where they can live and become stronger because there's less oxygen there, and that's what they thrive on. So they need, the good germs cannot live without oxygen, but the bad germs can. So once they penetrate under the gums, a war starts. That war is a war between our immune system. You can see it here here you can see the disease between our immune system and between those germs. What will happen is that our immune system will start attacking the germs, but will also start attacking our normal cells. They break them down, unfortunately. And I don't know if it reminds you, I don't know how knowledgeable you about COVID and what's happening now with COVID, but the same thing happens. It's a very similar mechanism. I'm not going to go into it right now, but this periodontal disease will break down, will cause a disease. It will break down the body, and then you can see it here actually. So to summarize again what I just mentioned, let's look at how it looks again in our mouth. So these are normal mouth. You can see that clinically the mouth are nice. They're looking great. They're all pink. If I'm looking at this cartoon, you can see that the gums are nice. Again, we have gums. We have the periodontal ligament and the bone, and everything is nice. The disease, the periodontal or the gum disease, starts with a disease which is called gingivitis. The gums are not so pretty anymore. The gums are more red, they're more inflamed, the gums will bleed a little bit. The bacteria, the germs that are around the teeth, as a reminder, they start from the gums. They start to create inflammation, but the inflammation is only on the gums. So you can see how the gums here, they're more red, they're inflamed, and that's the first step of the disease. The good news is that this disease is reversible. So if you guys are doing a good job, if you remember to go to your dentist to have a cleaning done at least twice a year, then, and if you do a good job at home with good oral care, at this point, this disease is, we can stop the disease from progressing, and you definitely can go back to a normal, healthy situation. If you neglect your mouth, or again, if you have not only gingivitis, not only gum disease, but you have many other underlying problems, or if you're stressed out, or your diet is not correct, etc., then you can develop the next phase is more complex, and that's where we get into trouble. Instead of gingivitis, what will happen, the germs are not going to only concentrate on the gums, they will start invading the bone, they'll go further down, eating away the foundation, eating away everything that holds the tooth. And as you can see in this cartoon, you can see that the gums are red, but look at the bone, and that's the really factor. This is what separates between the gingivitis phase to the periodontitis. The bone, the PDL, the periodontal ligament, the cementum, that's what's going to happen here. They're going to, the connection here, the small connections, the PDL is the connection, it's going to break. And then we're starting to lose attachment. As you can see in the last phase of this disease, where the disease is extremely advanced, the gums pull away from the teeth. Why? Because more bone and periodontal ligament, they're destroyed, they're broken down. The teeth may become loose, and then either they come out on their own, or at this point, when you go to the dentist, or to me, or to any other periodontist, those teeth will, we have no option of helping you out. So you can see at this point, the bone is extremely low. Pus is just a sign of infection. What happens if you choose not to do anything? You don't want to go to see a dentist because you're afraid now with COVID, or you're just afraid to see dentists in general because we're not, we're dentists. What do we know? Or we're frightening. But in any case, if the disease is not treated, then as we mentioned, the periodontium is going to get distracted. Of course, it's going to affect our mouth, the teeth, and very much important here, and that's what I wanted you to see with this here, systemic effect. So I'll tell you that those germs that are in our mouth, that are so severe, they're destroying everything that we were born to have, good teeth and beautiful mouth. If this whole foundation is getting lost, unfortunately, what stays in the mouth doesn't stay in the mouth, okay? So what happens is that all those germs, they go from our mouth through all the small blood vessels, and they actually start to penetrate our body. So it has a huge systemic effect. So that periodontal disease can affect your body, and that's the main concern. Just again, one more thing, and I want to show you here, and this is a severe disease, but I'll tell you, a lot of my patients, unfortunately, they come to me and they look like that. So this is not an exceptional picture. And I'm sorry that I know that this picture, some people here would say, yeah, I don't want to see it. But I want to show you how the gums, clinically, this is what we see. The gums are very red and inflamed. You can see the plaque, you can see the buildup on the teeth, you can see that the teeth, this is not natural. You know, all those, this is calculus. So those are a lot of germs, infection, pus on the gums, not to mention the smell, because I can smell, I'm looking at that picture and I can smell the gum disease. So there's really awful smell. The teeth, I'm sure that some of them are very mobile, they're wobbly. This patient is not happy, but surprisingly enough, some people have such a severe disease, and surprisingly enough, they're not in pain. So that's a fact. Having a gum disease, as much as it is severe, doesn't result pain. And a lot of people, that's why I actually see people sometimes at this stage, because if they, and I promise you that if they have pain, they will go to seek help. But most of the problem with this gum disease is that you don't know that you have it, because pain is not an indication. So don't wait until you are in pain to go see your dentist, because that is not the case, not with periodontal disease. Maybe yes with cavities, not always, by the way. You may have cavities that are very deep and not feel the pain, but with a gum disease, most likely you don't. So what are the signs of a gum disease? How would I know if I have a gum disease except for going to the dentist? So the breath can be bad breath that does not go away. You may brush your teeth, brush your tongue, or, it's not going to go away. Your spouse can tell you, hey, something doesn't smell right, something is going on. Most of the bad smell that people have is actually not coming from the stomach, it's coming from the mouth. Why? Because people that have gum disease, they have more chances of food getting stuck in between their teeth and going down and creating an infection. The gums are not pink. They become red, they become swollen. They can be tender, tender to touch, and sometimes the gum bleed. They sometimes bleed when you floss, when you brush, when you eat, or sometimes just bleed on their own. But bleeding represents infection or inflammation. Sometimes chewing can give you pain in your mouth. So that's, again, indication that the gums are swollen or inflamed or have a disease. The teeth may loosen up. They can become more sensitive to cold, sometimes sensitive to hot. And the gums can recede. You can see recession. You can see the roots showing instead of showing. Remember that I told you that the gums normally should be covering the teeth. So the crown is the crown. But some people that have a gum disease, what happens is the gums, they get so inflamed and the bone get damaged. So then we start having recessions. The teeth become longer. And then healthy gums and inflamed gums. When a patient comes to me, to a dentist, to a periodontist, to be able to know if the gums are healthy or not, I do an exam. So one of the clinical exams that I do is this, and it's a very simple exam, but I'm sure that most of you had this exam, and if you did not, then that's a must. Everybody has to have this exam at least one time once a year, actually. So with this exam, what do? I have a small instrument here that looks like a ruler. And this, you can see that it has markings on it. So that ruler has numbers. And those numbers, they represent depth. So what I'm actually doing, I'm going with my instrument. It's called a probe. And I'm checking the space between the gums and the teeth. Normal, when I not only check the space, but I also check the consistency, how thick, how good it feels when I use this instrument. So when we go by numbers, and we measure by millimeters. Millimeter is a tiny, tiny, tiny small number because everything is small. So what you think is tiny, for me, is huge as a periodontist. But millimeter, that's how we look at things. So again, I'm going underneath the gums, and the goal is to get some, I'm trying to sense. A lot of it is tactile. It's a feeling. So I'm feeling some resistance. I need to feel the resistance. What are the resistance is actually the fibers of the PDL that are stopping that instrument from going down. Normal size pockets are between 1 to 3 millimeters. That's the normal space. We all have to have a certain space. But if we have a gum disease, remember, all of that is going to get inflamed. It's going to be more mushy. I put my instrument in and I fall. I start falling in. There's no resistance. So when I fall in, it tells me that the fibers got damaged and I can fall in. So the bigger the number, the worse the situation is. So it starts with 3 to 5 millimeters, where the disease is more mild. 5 to 7 millimeters, it's moderate, and 7 to 10 and above, it's an advanced disease. So again, that's one of the things that I'm checking. Another thing that we're checking is we're looking at your x-rays. Again, x-rays should be done. There are certain x-rays, but I'm looking at x-rays that shows me your bone. This is an x-ray, that's how it looks. This is a tooth. This is a tooth actually with a metal filling. You see that the metal looks more white. This is an old good amalgam filling. So this tooth here, we see, I actually took it from the internet. It's a good picture to show you that this is the bone and that's the tooth, and this is the crown and the roots, and the tooth is held inside our bone. And this is a good picture that shows us that the bone level is nice and high. When a person has a gum disease, what happens to the bone? As I showed you and I told you, the bone goes down. So you can see here a patient with a gum disease. By the way, you don't see the gums here because it's an x-ray, but you can only imagine the gums are supposed to be somewhere here, somewhere here. We cannot see them on the x-ray. But a person that has a gum disease, this is a severe, by the way, this is a moderate to severe periodontitis. You can see that the bone went down. You see how far down this bone is, meaning that there's a huge pocket. Again, the gums should be somewhere here. I use my instrument, I fall into a huge pocket. And this is spacing in between the teeth, food impaction, and it's a vicious cycle here. Because I promise you that you are not able to do a good enough job here to clean the infection. So that infection destroyed your bone. It's something chronic. It's probably something that happened throughout the years. That's another picture here on the bottom. It shows you that when I use my probe and I use my instrument, I fall into a huge pocket. So I know it's big, and I take an x-ray, and you can see that this bone loss here is huge. Now, to remind you that this is just a two-dimensional x-ray here. This is a two-dimensional x-ray, meaning that in reality, this is way more advanced. How I'm talking and talking and talking about this disease, the periodontal disease, how common is it really? So, want to hear the numbers? Let's talk about numbers. So this is 2010, the numbers here. And I'll tell you that people are aging, and age is part of what we see with this disease. But let's look at numbers here. And this would, when I first saw it, my jaw dropped because this is crazy. So guys, half of American adults suffer from gum disease. 50% of American adults, 50%. 40, look at that. Adults that are older than 30 years, people who get to their 30s. How many of those people have a gum disease? 47.2%. Now, gum disease is not only periodontitis, it's the gingivitis and all levels of periodontitis. This is US, this is the US. In the US, about maybe 50% of people that are 30 years and older, they have a gum disease. We're talking about 64.7 million people. That's huge. And again, this was 10 years ago. The numbers today are going to be worse, I promise you. Adults, guys, I don't know how old you guys are, but I'll tell you that people that are 65 years and older, are you listening? 70% of the people who are 65 years and older have a gum disease. Did you hear? 70%, that's huge. Again, if you look at the distribution here, it tells you that this is with, again, people that are 30 and older. Most people here, most people, by the way, don't have a mild periodontitis. Most people don't have a severe periodontitis. Most people are here, moderate periodontitis. So it's not, sometimes not the whole mouth. It's enough that a couple of teeth are involved, okay? So sometimes, again, it's not the whole mouth. It could be an area of your mouth. It could be one tooth. It could be more than that. But those are crazy numbers. And why don't I see in my office or in all our dental offices, why don't we see 70%? How many people do you think go to see a dentist? Is it 70% of the population that goes to see a dentist in the US? No. Why? Budget, fear, and many other reasons. But it's not 70% of the people that go to see. And why? And I'll going back again to pain. Because people that don't have pain, sometimes most people that don't, a lot of people, they don't have pain, they don't think that there is a problem. So I'm going back again to tell you that pain is definitely not what needs to push you to go seek a dentist. Don't rely on pain, because you may have a severe gum disease without knowing that you have a problem. Even if you go to your dentist, make sure that the dentist does a gum check. And if the dentist feels that you need to see a specialist because your gum disease, it's more than what they can do to help you, please come, because we can help you. I do not want to see people that have an advanced disease in my chair, because sometimes I cannot help. If you lose bone to a certain degree, the only thing that we can sometimes give you is dentures, not even implants, because sometimes losing too much bone, it is going to be more difficult to help you restore your health. So try to see the dentist before. Why some people are more prone to having a gum disease? Why do we see that this gum disease is so prevalent? What are the reasons for gum disease? What are the risk factors? So I have to tell you that smoking, with the three risk factors that you see here, those are the main ones. So smoking is definitely one of the highest risk factors. Why smoking? Because smoking destroys blood vessels. It has so many other ingredients in the cigarette. It could be vaping, it could be smoking. Doesn't really matter. Smoking is really bad for your health, including our mouth. Smoking can cause oral cancer. Smoking can cause a gum disease. Smoking can cause staining. Smoking destroys so many other things in our mouth. So and the more you smoke, the worse it is. Uncontrolled diabetes. I'll tell you that as a periodontist, my population, a lot of my population are older people. And I'll tell you that a lot of the people that I see, when I see an advanced gum disease, one of the main thing that I do is not only detect the disease in their mouth, but I definitely send them to their doctor to check for diabetes. Because again, diabetes is a very common disease. And with diabetes, it's very similar to having a gum disease. It is not painful. People that have diabetes sometimes don't know that they have it. So the first time when they come to see me, sometimes the stand is more in their mouth. Having a gum disease and diabetes, they're related, they're like sisters. If I treat the diabetes, it will improve the gum disease. If I treat your gum disease, it will improve your diabetes. They go hand in hand. They're highly linked. Genetics. Genetics is one of the main risk factors. Why? Because of, again, we spoke about it, because of the immune system, that some people are just more prone to have a gum disease because they're just bad hosts. Their immune system cannot cope. I may be able to have good immune system that can cope with the bad germs. They cannot. This disease sometimes is running in families. So if you have somebody in your family that has a gum disease or lost teeth in a young age, or that's something that you have to check. And a lot of my patients, I tell them, go tell your family, tell your kids, they need to be checked for a gum disease. Additional risk factors for this disease are poor diet and stress. Again, why? Because it affects our immune system, and our weakened immune system, you will be more prone for a gum disease. Poor diet means that you don't have enough vitamins, omega-3, and et cetera, et cetera. And stress, of course, is so bad for us. Hormones, again, are also putting us in risk. Women specifically, as we age, we get to the menopause level, a lot of hormones, less estrogen can affect also the immune system. It's all related. Pregnancy, we know that pregnancy, women that are pregnant, they're more susceptible for gum disease. In pregnancy, by the way, extremely important to take good care of your mouth. There's research and evidence that shows that women that are pregnant, that are not taking care of their gums, they have babies that are smaller, they have premature birth. It's there's a huge connection between uncontrolled gum disease to pregnancy. Medications, a lot of people, a lot of older people or not, they take a lot of medications that can cause uh, dry mouth. Dry mouth, again, not having enough saliva, we cannot fight oral diseases. A lot of medications can actually cause inflammation of the gums. The gums becomes more thick. The gums that are more thick, they're more inflamed, and then the whole thing starts. A lot of anxiety medications, anti-anxiety medications, actually, they cause a lot of issues also with gums, et cetera, et cetera. Crooked teeth, overcrowding of teeth, also cause problems. Why? Because again, a lot of food impaction. It's more difficult to keep good oral hygiene, and again, the susceptibility of getting a gum disease gets higher. So a lot of times I will send my patients, after we treat the gum disease, we want to also improve their health, and we send them to have their teeth treated by orthodontics. Why? Because we want the teeth to be aligned, and it will help everything. Now, if you think that teeth are, you lose your teeth, you can get an implant, you're out of trouble, and unfortunately, I have to tell you that that's not the case. Why? Because dental implants are also susceptible to the same germs. So if you look at the gums, the implants are held inside our jawbone, and a dental implant is the most wonderful invention. I placed a lot of implants. I believe in implants, but I'll tell you that people that have a gum disease, history of gum disease, and they get dental implants, they have to do better job. They have to take better care of their implants because they're in higher risks of infections around the implants. So not to say that a person that has or had a gum disease cannot have dental implants. They definitely can, but we want to make sure that the gum disease is well controlled before we rush and put implants in somebody's mouth. And that person needs to be taking good care of their teeth. They need to do a better job, and they have to come and see the dentist more often to prevent an infection. If infection happens with the periodontium around the implant is actually more susceptible. We see the same process here. You can see it's called not periodontitis, it's called periimplantitis. Same source of infection. It goes down, goes under the gums, and then bone loss, and then the implant can fail. And that's how it looks. And this is one of my patients. So you can see in reality, again, I use the same instrument. I check around implants the same way that I check around teeth. So this is a disease that destroyed the bone that holds the implant in place. And those implants, they need to come out at this point because the implant is just a screw made of titanium, goes into the gums. And that's the foundation of our teeth. But at this point, honestly, as a periodontist, I'll tell you, there's not much to do. Those implants are contaminated with germs. We cannot clean them. So off they go. Then it's a lot of work here. Then we have to build up the bone again. If that person can get new implants, I'm not sure. I'm getting close to the last portion of my presentation here. And again, going back again to the periodontal disease. And I told you that what stays in the mouth, in this case, doesn't stay in the mouth. Why? Because all the germs that are not staying in our mouth, they're going to our body. There's a huge connection here. So the link between gum disease, periodontal disease, and our systemic health is really not new. People already started to notice that in the early 1900s. So that's a long, long, long time ago where they saw that, if our mouth is not healthy, maybe it affects our body. And as I told you before, and I showed you and I demonstrated, the periodontium, all the attachment, everything around the tooth is actually the portal to our systemic body. Why? Because it has a lot of blood vessels. And the amount of blood vessels that goes in the gums, in the bone, it actually what can actually spread the disease to our body. So think about all the blood vessels in our body. They're like channels, like roads, like small tiny roads. And when the disease, the periodontitis that starts, it causes local inflammation in our gums, micro ulcers. And the disease, the bacteria, it could be the germs themselves, it could be products of those germs, it could be the inflammation products that are is happening, and all of that will go into from to our body through the circulation, and from that area it just goes on and on. So again, it's just another way of me showing you, hey, it's not only the germs, it's also our immune response to the germs that is so destructive here. So with this gum disease, all the germs and all the destructive immune system will affect our heart, all the internal organs that are actually in close proximity, but the heart, the liver, the gut, baby, it shows you here that women that are pregnant, that disease can affect the babies, as I told you. Let's talk numbers here so you can understand how important it is. And I'll tell you, I get so many articles every day, articles and articles are and more research and more. Yesterday I got tons, and I wish that I have tons. When I prepared this presentation, I was reading so much, and it doesn't end. And I wish that I had more time, but I just didn't. It's so much evidence to show you what's going on here, and so it's so destructive to our body. So I'm reading it out loud. Heart disease, guys, people that have gum disease are twice as likely to have a heart disease. So having gum disease those people with gum disease, they are twice as much in risk to have a heart disease. This is huge. Just to show you, I'm going to skip here just to show you something. With the heart disease, the bacteria that we have in our mouth, it goes through our bloodstream, and what happens, those harmful bacteria, they go to our blood vessels, and they go inside, and they create something which is called plaque inside. So this is fatty stuff inside, and what happens, it makes our blood vessels inside more narrow. So then good blood with oxygen that needs to pass through cannot. So what will happen also, the oral bacteria, they trigger an inflammatory response, inflammation, and they cause the blood vessels to swell, and then less blood is going to the heart, and the heart cannot do its job to pump, and then there's a high risk of clots. Clots meaning that they're small. They found people that died, and they did autopsies on them. They found evidence of oral bacteria in their hearts. What does it mean? It means that the germs from the bad germs from our mouth are going to their heart, to the blood vessels. They get there and they create an inflammatory reaction, and this is really bad. And then if you look at I was just looking at that, and you see that this is talking about actually heart disease. But they're saying here, and number one cause of death in the United States actually is because of heart disease, not cancer, but heart disease. Actually, now it's changed. But the heart disease, you look at what it says here, risk factor for heart disease, very similar to risk factors for periodontal disease, poor diet, smoking, physical inactivity, alcohol, high blood pressure, high cholesterol, diabetes, and gum disease. It's not surprising. They're all linked together, okay? 80 to 90% of heart disease can be prevented with lifestyle changes. Periodontitis too. You don't have to reach the point that you have this gum disease. Look what it says here. Coronary heart disease patients' risk of death increases with every tooth lost. So this is huge. And so I'm going back to heart disease. Heart disease, by the way, connects us to stroke. Stroke. Why stroke? A person that he has heart disease, the heart cannot pump the blood well enough. There are small clots that can be spread out through the heart because the blood is coagulating. It becomes more sticky. And if a blood clot goes to our brain, it can create stroke. People with severe gum disease have 3 to 4 times higher risk of brain stroke. Huge, okay? Heart disease, twice as much. Stroke, 3 to 4 times higher risk. What about Alzheimer? Alzheimer. Alzheimer's disease, guys, there's a huge evidence. Gum disease may be linked to Alzheimer's disease and dementia. Why? Again, oral bacteria can spread through the bloodstream, can go to your brain, can cause that. Now, we're not talking about a gum disease that just happened because you ate a popcorn that got stuck in between your teeth and you have a local. Don't worry, they're not going to die from Alzheimer's. We're talking about a gum disease that has been there for many, many, many years, neglected, untreated well. So it definitely has continuous effect. Respiratory diseases. Gum disease can worsen conditions such as COPD. COPD is COPD could be asthma, and it may play a role in contraction of pneumonia. People that have gum disease can get more pneumonia, which is infection of the lungs, bronchitis, and emphysema. So you are more prone to having gum diseases. It's shown that in elder people that are in hospitals, which actually they did a lot of research that shows that people that are in nursing homes and hospitals, if their teeth are not brushed correctly because they're neglected, their caregivers are not doing a good job, they actually develop more, and they have a gum disease, they will develop more lung infections. So that's a proven cause and effect. Osteoporosis, people with gum disease may have a higher risk of osteoporosis. Diabetes here, it's on the bottom here, but this is a huge link. As I mentioned before, nearly 22% of diabetes patients, 22% of diabetes patients have gum disease. I can bet with you that it's way more than that. So diabetes and gum disease, they're highly related. They go hand in hand. I cannot tell you how many people in my chair, I diagnose them for diabetes. And when we treat the gum disease, their diabetes is getting better. The A1C is going down. Rheumatoid arthritis, again, look at that. RA patients that have inflammation in their joints, they're 8 times more likely to have a gum disease. Huge. And the last thing here is cancer. And that's another article that I received yesterday. But cancer, guys, several studies show strong evidence linked between gum disease and increased risk of oral cancer, pancreatic cancer, but not only. Pancreatic is liver cancer. This is one of the most horrendous cancers that somebody can have. But blood cancers, lymphoma, leukemia, kidney cancers, and it's huge. I actually got this article was talking about kidney cancers and gut and intestine. So that's a new one. If you look at the periodontitis here, by the way, it's more gender related. Men are more prone to have this disease than women. Why? We don't know. Part of it could be genetics. Part of it could be just because men are just neglecting themselves more, and women, they have more, they just care more. So they do better job with oral hygiene. So the disease can cause also, that I didn't know, 3 times more likely to suffer from impotence. Who knew? And then we spoke about all of that stuff. One more thing with women, again, menopause, 80% more likely to develop gum disease after menopause, post-menopause, because of different hormones. COVID and periodontitis. So when COVID happened, between me and myself, I was thinking about gum disease because it really has a lot of common things, and people that have, they're more prone to have COVID. Unfortunately, those are people that have more systemic problems. You're in higher risk if you have diabetes, you're in higher risk if you have high blood pressure and et cetera, obesity and all of that. So I was thinking to myself, I wonder if periodontitis really does have, people that have periodontitis, they're in higher risk to get COVID or not. So it hasn't been enough time, but this is a really recent article that came out. This is from June, so this is really recent. I don't think it's actually, you can see all those people here. This is a group of scientists from Harvard, actually, and they put it, and it's an amazing article to read. So if you guys, if you want the link to the article, or you can actually just put it on. This is the title of the article: Is periodontal disease a risk factor for severe COVID-19 illness? And if you read it, what they say is there is enough. They just bring so many diseases and how they're linked to gum disease. And the bottom line is there is enough evidence to propose that periodontitis, it is actually a risk factor for COVID-19. So because periodontitis has been widely associated with several disorders such as diabetes, high blood pressure, obesity, among others, it could be an indicative of systemic health. So all those, and usually people that suffer from diabetes, a lot of them would have, they are obese, so they act together. So we know that with those patients here, they're in even higher risk. And those, all of those are common risk factors, and they definitely will increase the chances of, unfortunately, being hit with COVID. So that's it. Hope you learned a couple of things. Hopefully I didn't bore you to death. And I would like to also thank Dr. Lamuel here, Dr. Brandon, for being such a great host, not a bad host, but a good host here, and giving me a stage here, because I know how important it is. And I'm telling you honestly, as a clinician here that I see so many patients that are just neglected, and it's a shame. And we want to make sure that this is something that we can control, and you can control it. I would like to maybe, Kristen, if you can show me how to.
Dr. Sperling, you can hear me, right?
Okay, I can definitely hear you. Yeah.
Okay, Dr. Sperling, really amazing. I have 7 pages of notes from your talk, so thank you. And I know that my patients received a lot of value. As comments are coming in just saying thank you for the presentation, and they received a lot of value. I know your clients, anybody else who found us maybe through Eventbrite in the community, or maybe your colleagues, other dental colleagues there that found us this way. But a lot of great information that is super relevant to what's going on in the world today and relevant to our current state of health. But what I really appreciate is your passion around this topic. Is very obvious. You know what you're talking about, but you're passionate about it, and you truly have a heart to help people. And that's what I really appreciate about you. And thanks for coming on to share your time, your knowledge with our peeps and your people, and really to help support everybody's health and wellness. I encourage anybody, if you have any questions, you're still on here. Dr. Sperling is offering to give some more time. Type in your questions below. And yes, John says, I should have heard this 40 years ago. Said, Dr. Sperling, where were you 40 years ago? So
let me tell you, John, I'm still here. And there's always hope. There's honestly always hope. I want to tell you, a couple of things here. And I know Meryl Hirschman, she's a great patient of mine. She's an awesome person. And she's asking us a question. But I do want to involve, and I'm going to answer Meryl, but I want to actually talk to my fellows here. And I'm hoping that they can hear us. And I don't know if we can see them or not. We have a couple of patients here. I know that some of the dentists here, I'll tell you that it's a busy dental day in their office. And some of them that were supposed to join me today couldn't, but I know that some of them are here. So Dr. Brandon, how do we make it happen that we can actually view them, or at least hear what they have to say to us, because they're valuable? I know that Dr. Diane Fem should be here, and Dr. Ahmed Saad should be here, maybe some others. So is there a way that we can see them here? How do we do it?
Okay. Well, you know what is great? I love challenges here. I
Right.
think I can figure this out.
Kristen, can you get me
So
out?
is it Dr. Diane Pham? That one?
Yes.
Okay, hang on a second. Here, let's see if we can do this.
Can you show
I
me
think
the
we
question?
can. Let's see here.
What's the difference between different parts of the globe? By the way, my mouth is doing great.
Oh, you know what, Doc? I gave controls over to you, so you are the host.
Ah,
So simply what you do is go down on the list of participants. It'll say panelists and attendees. Go to the attendees and you'll know their name, and then you should be able to pull them over as a panelist.
the participants. Okay. Okay, let me see how we can do it.
And it looks like you can see the Q&As also.
The Q&As I see.
Okay, good.
Okay, got it. Okay. Guys, I see a lot of my patients here, which I thank you. Awesome, I'm happy that you're here. Diane, Dr. Diane Pham is here. I'm gonna pass it on. Let's see, I'm just looking to see if I have some more doctors here.
Hi, Karen, can you hear me?
Oh, Diane, thank you. Thank you so much. So we cannot see you, but we can hear you.
I'm here.
Awesome. Let's see if we can put, do you see Ahmed Saad here? Diane, one of the people here asked, and actually Mary, one of my patients, she's asking if can using an electric toothbrush, can it damage or thin the enamel layer?
If you use it properly, no. And if you press too hard on it, there's been studies that have shown that pressing too hard can, and I'm sure you can elaborate on this much better, Karen, cause recession. There's been links to toothpaste being very abrasive that can contribute to further damage to the tissue. But if used properly, no, it's a very good aid in proper oral hygiene. So in dental, my office in particular, and I'm sure yours, we encourage the proper usage of an electric toothbrush. They're very helpful in preventing biofilm as well as just ensuring proper oral hygiene.
Yes, I agree. The enamel is it's strong, but definitely, and I'll tell you that brushing hard can definitely cause the enamel to be more thin. So, in a lot of unfortunately, a lot of the materials, some whitening toothpaste and things like that, they're great. And yes, can they whiten? Yes, but they also can cause a lot of damage. So what's important here, Diane, is as a periodontist, I always say, hey, you have a gum disease, try to use I love electric brushes. Try to use an electric brush versus a manual one, because it gives you more control over things. It's more consistent. And people that have recessions, we always recommend an extra soft head with electric
With
brush.
electric toothbrushes, they have timers and they have just a lot of great features that allow patients to be programmed with how they brush, like the 2-minute cycle and the quad pacer for 30 seconds per section of your mouth is always really helpful. And we see really improved home care in patients who switch over from an electric toothbrush, switch over from a manual to an electric toothbrush. So they are very helpful.
Yes. John Myra is one of my patients here. He is 87 years old, and because of you, I water pick, floss, and brush electric every day. Awesome, John. And John, don't know if I can share it or not, but John is doing great, and implants and all of that. But yes, John, you're awesome. What else? What else? I'm reading your notes. I have John asked us if we can discuss differences in periodontal disease between different places in the globe. It's a great question. That's a good question, actually. Yes, and actually there is research that is unique, things that are more unique to India or more unique to Korea or Japan. And I'm sure that the percentage, So the periodontal disease is the same. I don't think that genetics, like, I don't think that it's different between genders, yes, but between Asians versus white versus black, don't know if there's a huge difference there because our body is our body. But I don't know. Diane, what do you think?
I tend, I would feel that that's more your area of specialty, but as a general dentist, I would say that there are certain ethnicities that I have found to be more prevalent with perio disease. Now, I'm not certain if it's a genetic component to it or if it's just a matter of coming from a society where prevention isn't really advocated. Like, for instance, in Britain, they just don't have the insurance that allows people, the population, to seek regular cleanings like we do here in the US. Certain populations will, in certain parts of the world, they will go for emergencies, for tooth extractions when there is pain, like you said, and by then it's too far gone.
Right.
But with prevention, you can really help prevent perio disease. So that goes, so it's a mixed answer. I'm not really answering it directly. I do think that certain races, certain, like Asian versus European, I haven't read any reports, but just in seeing the patients, I do see a certain tendency with something just like with diabetes, certain races have more of a tendency, have more of a population that's higher risk of that. I think that's a better way of saying it, the risk factor. But I do think that a lot of it has to do with prevention. So kind of a mixed answer, sorry.
No, I know. I am with you completely, and I'll tell you that it's hard to do
It's a
research
good
on
question. Yeah.
It's a good question. I'm not honestly not knowledgeable enough. I'm sure that there are some differences. I know that for sure that certain type of gum disease are more common in Black people. Just that's the genetic that are young with Black people. Sometimes it's more common to see something what we called aggressive periodontitis. It's a disease that starts at a very early age, in puberty actually. So we see a lot of damage on the gums and teeth that starts on an early age, and that definitely has a genetic component. But is it something that, definitely is, chronic periodontitis? Does it happen in I don't know. I just don't know enough.
Yeah. I agree.
It's a good question. Another question that we had here was about water pick. Is it better, worse? What do we think about water pick versus flossing and brushing? What do you recommend, Diane?
I think it's a great adjunct to brushing and flossing, but not to be substituted for brushing and flossing. I've been asked a lot if water pick can substitute flossing. I personally, the studies with water pick, as the representatives from the company have come to me, they have said that their studies have not linked that flossing is any better than water picking. I'm interested to hear what you have to say, Keren. I know that water pick is very accessible to implants and bridges, but in general, what are your thoughts? I'm throwing that ball back into your court.
I think that there's honestly nothing better than flossing and brushing, but a lot of the patients, a lot of the people that I see, they're just the dexterity, the fact that using a floss is not always easy. And some people prefer picks, and some people prefer the floss that has like, it looks like a small fork because it's easy. So not all flosses also are alike. But I love flossing because I think that it just really gets the food in between. The water pick is, like you said, Diane, it's an adjunct. So it's good to have. People that have periodontal disease, they have more spaces between their teeth. Sometimes the pockets are deeper. So it really does help to wash off the all the germs and everything that goes under the gums. So it's great to have, Would that be a substitute for flossing? I don't know, you know. But water pick, you know, I'll tell you that it's great for even for kids. My daughters are going through orthodontics. The water pick helps to clean in between the retainers. Um, they're great. Water picks is just a great invention. But is it a substitute? I'm not sure. We're limited with how much we can go under the gums, even with water picks or with floss. So it's better to do something than nothing. But I don't think it's like comparing apples and oranges.
I agree.
Any other, I see some other questions here. Let me see if we can. Do you floss and then brush? Do you floss and then brush, or then do you do the opposite? Do you brush and then floss? Diane.
Oh. um, So I'd love to hear what you have to say, Karen. As a GP, I generally like to tell patients to floss after brushing. I know that a lot of people say floss before brushing. I like to have patients do it after, simply because after you brush, your teeth feel super clean, you feel good. Some people don't think it's necessary to floss afterwards, but even after you brush and use the electric toothbrush and water pick, flossing will still get debris out of the teeth. So I feel like it really reinforces the importance of proper oral hygiene, incorporating flossing into your daily routine. So that's my sequence that I generally tell my patients, and then following it up with a good mouthwash afterwards.
I actually say the opposite.
Yeah, I know, I predicted that. A lot of people take the opposite. That's just my take. But I feel that as long as you do both, we don't complain. So,
We don't. And it's true. Dr. Pham is right. There's no right and wrong. There's just do both. Do both. Do the flossing at least. You want to do brushing twice a day, morning at night. The nighttime when you brush is the most important, because when we go to sleep, our mouth is more dry, food tends to collect more. So we definitely, the best brushing, the most important brushing of the day is actually at night before you go to bed. So I always encourage my patients to use an electric brush and concentrate. Just spend 2 minutes. It's not a long time. Do it in front of your TV. Do it. Make sure that you remove the plaque and the germs. So that's the most important time. In the morning, people sometimes are in a rush. You can use your manual brush. You can use the electric, so you don't have to pay so much attention. But the night is very critical. And then at night, you floss. Again, does it really matter? It's the egg and the chicken. Really doesn't matter. It could be either before or after. But the floss helps us to remove particles that the brush cannot go, because the brush cannot go in between. So I definitely agree with Dr. Pham. It really doesn't matter as long as you do it. We had another question, and I don't know if we have enough time, but the last question maybe. No, another question. It's related, waxed or not waxed. I don't know. I think it's a matter of preference. I personally like waxed because I feel that it doesn't get stuck. It doesn't tear. It's easier. Sometimes I've heard other ways. Some other dentists would say use a non-waxed, because it can attach the bacteria more. Use a floss. The bottom line, use a floss. It's your own preference. Either one is good as long as you do it. When you use the floss, by the way, you want to turn it around the teeth, never ever go down, because you do not want to destroy the gums. The Ronald Lemuel, you're connected, Dr. Lemuel?
Yes, that's my dad.
Hello, Dad. So Dad was asking us, is there a downside to implants? I don't know what it means by downside, but implants are a great invention, and it's one of the best inventions in dentistry, actually. So there are downsides. No, but I'll tell you again, as I mentioned before, a patient that has a periodontal disease, I would be, I definitely place implants on patients that have a periodontal disease, but we want to make sure that the disease is controlled. The downside is that an implant does not, once we put an implant in person, an implant is not a tooth. It doesn't have a PDL, right? Once the tooth is taken out, there is no PDL anymore. So once an implant is being placed in, the receptors of pain, when somebody, you are more prone for trouble here with implants because you don't feel that there is pain if something goes wrong. An implant can lose, you may have peri-implantitis, a disease around an implant without even knowing that you have a disease because you're not going to be in pain. So that's why the importance of going to see a dentist on a regular basis, having your implants and teeth checked, having cleanings done on a regular basis, it is critical, specifically with patients that have implants. That's my, Diane, do you have anything to say?
No, I agree with you 100%.
Kristen, can you pick it up? I think it's Uri. It wasn't. Any other questions, folks, before we end this presentation? By the way, Dr. Fem is a general dentist. She's in Vienna, and she is one of the best. So if you, she's really, as you could probably can tell, but she's great. We've been working together. We're a good team, and we are a lot of our patients. We have a lot of mutual patients because it's the systemic connection. But I have a lot of other dentists here, and again, I just cannot see those other dentists here right now. But we have a great, I'll tell you that this area is a great area. Lots of good dental professionals here that care, and that's important. I don't see any other questions. I think that we kind of went through all of them. Maybe one more here, just. A lot of compliments here, which I really compliment. I see a lot of people here. Wanted to say before we break, can we go back again to the slide? Can I go back again to the slide, Kristen? We want to tell you that, and Dr. Fem, thank you so much for jumping in. And I know that we did not, this was like spontaneous, honestly. I'm going back again to the presentation. Can you go back again to the first slide? If you minimize it, then you can see. And thank you, Kristen. I forgot to thank Kristen, but Kristen is my hands, my everything here because she's helping me out. Kristen Lewis, she lives also in Vienna and she's a mom and she's doing my marketing here at the office and she's wonderful. And I really thank you from my heart. And I just wanted to show you one more thing here before my presentation. If you like what you see and you want to see more, we may do some more lectures in the future, who knows. If you want to, again, go on our Facebook page, be our members, like us, follow us. This is my page here on Facebook, it's Dr. Sperling. And once you go in, all you need to do, if you want to try to participate in this, getting this amazing oral health basket that Kristen here created, and it's actually, you see that it's actually COVID health basket as well, because we put a lot of stuff there for COVID, anti-COVID. All you need to do is you want to go to my Facebook page, and then you find that post that is, this is actually the presentation post that the invitation, and then just give us the feedback. You want to say, I like, and then put a word or two so we know who you are. And then we're doing a raffle for this basket. And if you don't win this time, you may win next time. So follow us on Facebook because we try to, I honestly don't want to hassle people. I don't put too much. But when we find that there is a good article, something that would be relevant to you, something interesting, or promotions that we do, that's the place to find us. So thank you, Dr. Brandon, Dr. Lemul. Thank you so much for being my host tonight.
You did great, Doc. Thank you so much. It was awesome. Have a great night.
Thank you. So I'm supposed to be in charge here and close the presentation.
Got it.
Yes, Kristen? Kristen is going to do it. Keep well, be well, stay safe.